Hello everyone, my name is Clara Sauls and I'll be going over this week's discussion. The first question asks, what is your capstone project's question? Well, my project's question involves how to better understand patient-clinical relationships with healthcare aspect principles. What I mean by this is I'm trying to figure out how to incorporate more time with the patient so that nurses can perform better care and assessments to meet earlier discharge dates to restore the patient to their optimal levels. The second question asks, what is the purpose of your capstone project? Well, the purpose is to have nurses and patients to benefit in attaining better patient-centered care by having an accurate view of time management to spend more one-on-one time with the patient, thus promoting patient trust, compassion, empathy, self-awareness, and transference to maximize their healthcare needs. It will benefit nurses by providing an educational tutorial provided by having information to better patient-centered care. It will help the patient more by the nurses being more supportive while maintaining an optimal professional relationship. The next question asks, what is the significance of your capstone project? Well, the significance is to promote more one-on-one time with the patient to encourage better safety. What I mean by this is to prevent or to have fewer falls, prevent medication errors, such as by having the patient to ask questions such as, what medications are you taking today? Or what is the color of this pill? And what does this pill look like to you? Is it a blood pressure pill, a pain pill, and so on? This will help to maintain more in-depth professional relationship with the nurse when providing care. The reason why I became a nurse is the reason why I wanted to do this project. The reason why is because my grandmother broke her neck and hip while taking a shower. She went to a rehabilitation care facility after being hospitalized and having neck surgery. When I saw her, the nurses were passing medication, did a brief assessment, and left the room. And this was under about 5 minutes. I didn't say anything, of course, to the nurse because I work as an LPN and I understand having between 20 to 30 patients a day in a 12-hour period, it's very hard to see everybody and to give the proper set of care. So my goal is to give more time back to the nurse to better patient-centered care. The next question asks, what is your plan during the semester to implement your project? Well, my plan is to implement the patient-centered care project by involving having a prolonged time to pass medications while focusing on more assessments. I want my project to promote a long-term effect so that patient-centered care can focus on more than having a time limit by providing more nursing staff and maintaining better time management. My project also involves making social changes in medical practices by eliminating the passive roles. So what I want to do is I want to ask more open-ended questions that improve overall behaviors to the patient to be more involved with their care. So I would do this by evaluating their input from the patients and healthcare staff due to the change can be hard for nurses and patients. This will help by having a questionnaire that is personalized relating to the patient's or nurse's direct needs. Also, for example, I can give the questionnaire to a patient. I'll be like, what do you feel is most important about your health? And how are ways we can overcome that based on what you think is best for you? And then the questionnaire for the nurse would be like, well, what do you think is best for the patient? Or could you have talk to the patient more to understand what will best fit their direct needs. Another way I can promote my project to be successful is by finding nurses who have objectified views, so I can include what their pros and cons are by having ways to overcome them with measurable outcomes. Again, thank you.